Hello, welcome to this month's Team Brief. My name is Dennis Okolo. I am Medical Director at North Staffs Combined Healthcare Trust. We are following a different sort of format this month, and we have a range of topics that we want to talk to you about this month. So let's have a look at some of the topics that we will be discussing today. The first is our staff survey from 2022 staff results. Once again, Combined Healthcare has achieved incredible results and scores compared with our cohort mental health and learning disability trusts. I am pleased to be able to share the staff survey results that we have received, and thank you to everyone who took part and took their time to share their voice and experience with us. You have given us the best response that we've ever had at 69.2%. This meant that you have been able to provide valuable feedback. This feedback is not only to inform the way we listen to our people and the way we run our services, but it also will get us, enables us to get things right for you and where we need to focus our energy in terms of supporting our staff going forward. So Marie, our engagement lead, will be breaking down the feedback according to directorate level results, and these will be shared across all the directorates during April. And this will also encourage you all to get involved and helping to create an engagement plan to identify where we can make bespoke changes for you to, within your teams. Thank you again for your feedback, and do please continue to get engaged with your directorate plans and with your the services that we deliver. As we move from the trust staff survey, our trust strategy for 2023 is being published this month, and we are excited and motivated to present our strategic aims of prevention, access, growth. And we'll continue to embed these throughout the year in the next 12 months. Thank you to everyone who has been involved, our staff, wider stakeholder, for your contribution to this work. So the next topic is that we recently had a visit from Sir Julian Hartley, who visited Harplands Hospital. He's Chief Executive of NHS Providers, and during his visit he had a tour of Ward 6 and the Crisis Care Centre, as well as having a good look around the Project Chrysalis. As you know, Project Chrysalis is very close to our hearts. So Julian shared feedback from this visit. He left really inspired and enthused by the great work that the staff have been doing. The power of integration across healthcare is fundamental and part of the trust's approach. He also informed, with a very practical can-do attitude that he found at Harplands during his visit. The next visit we had was from Lord Lieutenant, who visited Harplands as part of the unveiling of the Combined's recent Veterans Aware accreditation in March. The Lord Lieutenant of Staffordshire visited Harplands Hospital and unveiled the plaque, but also this was done alongside John Henderson, who's Chief Executive of Staffordshire Council, as well as David Wood, who's the Veterans Covenant Healthcare Alliance Regional Lead for the Midlands and the East of England. They were welcomed by Ben Richards, who's the Director of Operations of the Trust, and some of the board leads. He's also the board lead for veterans and other representatives of the board and various Combined Healthcare colleagues. The Lord Lieutenant also had a chance to meet staff at Combined and to learn more about how veterans and their families are supported by the Trust. As we move forward, we are soliciting your help. If you will be able to support a service user to share their experience of the trust with us, we are looking for individuals to share their experience This includes their experience or feedback and how they may inform changes that we want to make within the organization. So this is also a chance to highlight the fantastic work of your team. If you know of any individual or service user who would like to share their story with us, then please contact the communications team. Of course, you do know how to contact them through CAT. As a new process, we are changing the way that we provide exit interview questionnaires. As you may be aware previously, there was a link from SurveyMonkey that was shared with our staff members in the process of leaving Not Staff's Combined Healthcare Trust, which allowed them to provide an opportunity to give feedback about their experience of working within the trust. Moving forwards and with immediate effect, once a termination form has been completed on EASY or ESR, an exit questionnaire will now be automatically generated via our electronic staff records system to the staff member as their NHS email address. This would enable them to provide feedback to the organization. So next topic is wage stream. We recognize that some staff members are experiencing some problems with wage stream. There are a number of factors that can affect the outcome of wage stream, including that you must have an active assignment number. If you continue to have problems, please contact WageStream contact support team via email at support@wagestream.com. For more information regarding troubleshooting your WageStream account, please visit CAT under People and Support. The next thing I want to share with you is the Wellbeing Hub, which is hosting Tackling Health Inequalities. The Staff Psychological Wellbeing Hub will be utilizing the Be Well Midlands funding to support the co-production of staff toolkits. These are tailored for underrepresented staff groups. The first steering group was held on the 1st of March and involved EDI leads, staff networks, partners, and other organizations. The next topic will be about sustainability. Join us to celebrate sustainability at Combined Healthcare Trust on Friday, the 28th of April from 1 to 3 p.m. The event attendees will have the chance to participate in distributing flower bombs and opportunity to take sustainability pledges, as well as browse a range of local stalls and learn more about the virtual sustainability initiatives taking place across Combined. Please contact Karen Day if you have any queries or any points about the event. Adults are now able to self-refer to Combined Healthcare Services via the Wellbeing Portal, similar to the young person's online referral process via the Wellbeing Portal. The referral can be made for individuals or on behalf of someone. You can now find online referrals by clicking on the Professional tab on the Wellbeing Portal. Next, we'll be talking about Inspiring Combined Innovation and Improvement Conference. You can now book your place at Inspiring Combined, the Innovation and Improvement Conference on Wednesday, 10th of May at the Yarnfield Conference Center. The day will involve workshops and presentations from keynote speakers. To book, please follow the link in the slide. Finance. In terms of our finance update, at the end of February, the trust is underspent by £177,000. This is due to a number of factors, including ward overspends due to high acuity, resulting in additional staffing costs, and a shortfall in savings and CIP. For more information for the month of February and for finance training, please follow the link in the slide. As we are at the end of the financial year, please can you ensure that you receipt EGR all your goods and services in a timely manner to ensure that the costs are entered into the correct financial year. As our services we have received needs to be entered and actually receipted by the end of the year, which is 31st of March 2023. And finally, if you have any feedback on Team Brief, please contact the communications team at communications@combined.nhs.uk. Thank you